Meeting call to order.
I request Rotarian President Mrs. Hemlata Bhandari to confirm the minutes of the previous meeting.
The minutes of the previous meeting were circulated on the group, and I hope everyone has read it. And since no queries and questions were raised on the same, the minutes of the previous meeting stands confirmed.
Thank you so much, President. Good evening, everyone, and welcome to yet another Rotary meeting. आप सभी का इस रोटरी मीटिंग में बहुत बहुत स्वागत है। आज का टॉपिक है एडवांसमेंट्स इन लिवर ट्रांसप्लांटेशन, व्हाई अवेयरनेस स्टिल मैटर्स। और हमारे बीच बहुत ही अच्छे डॉक्टर हैं फ्रॉम नानावटी हॉस्पिटल, डॉक्टर हुनैद हतीमी, प्रिंसिपल कंसल्टेंट HPP सर्जरी एंड लिवर ट्रांसप्लांट, नानावटी मैक्स सुपर स्पेशलिटी हॉस्पिटल, मुंबई। एंड मैं रिक्वेस्ट करूंगी रोटेरियन रूपा अरोरा जी से टू इंट्रोड्यूस द गेस्ट। रोटेरियन रूपा अरोरा जी खुद एक लिविंग लिवर डोनर है, उन्होंने अपने हस्बैंड को उनका लिवर डोनेट किया था। शी इज फ्रॉम चंडीगढ़। I request Rotarian Rupa Arora ji to please unmute and give the introduction of the guest today.
A day and a half because there are still 55 overs notionally left in the day's day.
I request everyone to keep mute. I understand the Wimbledon is going on, but I think the meeting is more important than the sports. So please keep all yourself mute. Yes, thank you.
Rotarian Rupa Arora ji, please unmute. Rupa Arora ji, please
Yes.
unmute.
Okay. Good evening, everyone. It is my privilege to introduce our distinguished speaker for today's session, Dr. Hunaid Hatimi, Principal Consultant, HPB Surgery and Liver Transplant at Nanavati Max Super Speciality Hospital, Mumbai. Dr. Hunaid Hatimi is a highly accomplished pancreatobiliary surgeon and liver transplant specialist with extensive training and expertise in complex liver, pancreas, and biliary surgeries, as well as liver transplantation. He completed his fellowship in HPB surgery and liver transplant and holds a DNB in surgical gastroenterology from the National Board of Examinations. He also earned his Masters of Surgery in surgical gastroenterology from King George's Medical University, DNB in General Surgery from the National Board of Examinations, MS in General Surgery, and MBBS from TN Medical College, Mumbai. Throughout his academic surgery, Dr. Hatimi has been recognized for his outstanding achievements. He received the Best Resident Award during his MS General Surgery training and the prestigious Maharana Fateh Singh Award for Academic Excellence in the CBSE Secondary Examination. He is an active member of Liver Transplant Society of India and the Indian Association of Surgical Gastroenterology, reflecting his continued commitment to excellence in patient care, education, and advancement of liver transplantation. Ladies and gentlemen, please join me in extending a warm welcome to Dr. Hunaid Hatimi. We are honored to have him with us today and look forward to his valuable insights.
Thank you, Rotarian Rupa Arora ji, for the introduction, and thank you, Dr. Hunaid, for taking out your valuable time and being with us today. Over to you, Dr. Hunaid.
Thank you so much for the kind introduction. Warm greeting from Nanavati Hospital, from where I work as a principal consultant in hepatobiliary and liver transplantation. Today I shall be talking on advancements in liver transplantation, and mainly I will focus. Next slide, please. Next slide, please.
Next slide, please.
Yeah.
Today I'll be focusing on the importance of liver as an organ and the burden of the liver disease. I'm going to give you a brief history of how liver transplant started. I'm going to talk about the outcomes of liver transplantation, and at the end I would like to speak about the advances and what is the future of liver transplantation in the world. Next slide, please. So if you look at the global burden of liver diseases, 2 million deaths annually occur just because of the liver problems. And out of which 4% of all the deaths, that means 1%, one death out of every 25 deaths worldwide are occurring because of the liver disease. So you can imagine the burden of problem that the liver has, that the world is facing because of the liver disease. And majority of them are men, which is almost two-thirds of the cases. And within, if you look at this estimate, then as we know that liver disease ultimately lead to liver cancers, and the liver cancer accounts for almost 6 to 9 lakh deaths per year in the world. And if you talk about India, we have a very high incidence of metabolic associated fatty liver disease. So basically, metabolic fatty liver disease is seen in patients who are basically suffering from diabetes, hypertension, obesity, hypothyroidism. So if you look at the burden of metabolic associated liver disease patient in India, almost one third of Indian population is suffering from metabolic associated liver disease patient.
Yeah.
If you look at, I think my slide is not showing.
I think there's some problem there. One moment. I will just see what happened. Please join again. Huh? Hello? Hello? Okay. Just hold on, please.
Yeah, no worries.
There's some technical. I think she has already. Yeah.
Can you see my slides, sir?
Yeah, I can see your slides, but it has to be one moment. I think. Yeah. Yes. Now it is there. Yes, you can go ahead, doctor.
Can I go ahead?
Yeah.
So, as I was mentioning, that one third of Indian population is affected by metabolic associated fatty liver disease, which is mainly
Meeting join karo. Yes, please go ahead.
which is seen in patients who are suffering from diabetes, hypertension, obesity, and thyroid problems. If you look at the burden of hepatitis in Indian population, 40 million people are suffering from hepatitis B as a carriers, and 6 to 12 million people are suffering from hepatitis C infection alone. Although the incidence of alcoholic liver disease has fallen down, but it is still one of the most commonest indication for liver transplantation in our country. So before I talk about liver transplantation, let us see what is the function of the liver. So basically, liver has three main important functions. The first is the metabolism. It carries out metabolism of the nutrients. The other important function of liver is the detoxification. It detoxifies all the toxins from the body, and it helps in immune function. So basically, the immunity of the body is controlled by the liver. So suppose if the liver is not functioning well, a patient becomes highly susceptible to infections. If you look at this car, you can see that the car looks beautiful with intact tires, the body, the lights, the seats, and the steering. But if the engine is not working, the car is not going to work. So basically, the liver is a engine of the body. So if everything else is working well, the heart, the brain, the kidneys, but if the liver is not functioning well, the body is ultimately going to fail. So how do you ensure healthy liver? The most important thing is to have a balanced meal. And what do you mean by that? Is you should have a diet which is rich in green leafy vegetable, whole grains, and lean proteins and fruits. Not all fats are bad. The polyunsaturated fatty acids, omega 3 fatty acids, are good for health. They basically helps in detoxification. They basically act as antioxidants. But one should avoid trans fat, which is mainly present in fried items, processed foods, and etc. Ideally, the protein intake should be roughly around 1.2 to 1.5 grams per kg body weight, and the sodium, which is mainly the salt, should be restricted to up to 8 grams a day. Apart from that, you should have adequate intake of fibers. It basically helps ensuring the satiety, and you don't end up eating more if you have more fibers. Hydration again is very important, because hydration not only helps liver, but it also helps flushing the toxins from the body. The daily exercise and adequate is also important to maintain the liver health. And one should avoid sugar drinks, especially the colas and everything. It has got high sugar spikes, and it causes a lot of damage to the liver, along with alcohol and hepatotoxic drugs. Basically, all this Ayurvedic preparation, kada, painkillers, they are hepatotoxic drugs, and one should be very careful in taking those medications and should avoid if possible. And the most important thing to prevent having liver disease, especially hepatitis, is to vaccinate against hepatitis B virus. So what are the symptoms of liver disease? Suppose if there's a person who is suffering from liver disease, how do you pick up the early signs? So the biggest problem with liver disease is there is no early signs in majority of the patients. So the reason being that till your 20% of liver is functioning, you will have no symptom. That means if your liver damage is almost 80%, still you will not have symptom. Only if the damage is beyond 80%, you will start seeing the symptoms of the liver disease, which is mainly the yellowing of the eyes and the skin, which is called jaundice. Sometimes you can develop edema of the feet and fluid accumulation in the belly, which is called ascites. You can have pain in the abdomen. In certain cases, you can have a lot of itching and dryness of skin. These are the signs of liver failure. So irrespective of the cause of the liver failure, all the causes of liver damage, they progress to these particular stages. So first you will have a normal healthy liver, then there will be fatty deposition of fat in the liver, which will cause the size of the liver to swell. It will later convert into fibrosis. So basically, any damage to any organ in the body, the natural response is fibrous tissue deposition, which is called fibrosis. Till this stage, it is irreversible. But if you don't take care of a liver till this stage, then it can lead to permanent scarring, which is called as a cirrhosis. And if left unchecked, it can lead to formation of cancers in the liver, which is the last stage of the liver failure. So what are the treatment options for liver disease? So as I earlier said, lifestyle and dietary modifications are most important. You can prevent majority of the liver diseases if you have a healthy lifestyle and if you can have a healthy diet, which is mainly, as I said earlier also, should contain all those stuff. Second is, suppose if you have got a liver disease, so there are specific treatments when the etiology is known. Like for example, if the liver disease is because of hepatitis B or C infection, there are antivirals available. You can take them. If it is because of the autoimmune hepatitis, you can take steroids and treat yourself. If it is because of the excess copper deposition into the liver, you can take chelation therapy. Or if it is because of the fatty liver disease, you can take the latest drugs which are available, which is GLP-1 and GIP inhibitors, mainly Mounjaro and semaglutide. All of you are aware of it. And if the liver disease has advanced to liver cirrhosis or the end stage liver disease, you can opt for a liver transplantation, which is today going to be my main topic of discussion. So before we talk about advances in liver transplantation, which are the patients who need liver transplantation? So a patient who has developed severe complications of liver cirrhosis, which is the end stage liver disease, they are the ones who will benefit from liver transplantation. Second subgroup of patients are those who have a healthy liver, but all of a sudden, because of some reason, the liver function has gone down significantly. It is called as acute liver failure. Normally, it is seen in patients who are suffering from hepatitis A, hepatitis E, or if they have taken some drugs in the form of toxin like rat poison or anti-tubercular medication, which causes the liver to fail suddenly. Or there are other causes of liver failure, in which case liver transplantation becomes the only life-saving measure. And the last subgroup of patients who benefits from liver transplantation is those patients who have liver cancers. They also benefit from liver transplantation. As far as the history is concerned, Thomas Tarzell was the first American surgeon to perform successful liver transplantation way back in 1963. But his subsequent there were subsequent mortalities after the liver transplantation. Till in 1990s, the outcomes of liver transplantation improved. Thomas Tarzell not only pioneered the surgery, he also pioneered the art of immunosuppression, which is generally required in patients who undergo liver transplantation, because you need to suppress the immunity, because obviously the organ which is transplanted can be rejected because of the immunity. And he also pioneered the preservation solution, wherein the liver used to be kept before it can be transplanted into human body. That's why he's considered as father of liver transplantation. As far as the types of liver transplantation is concerned, there are two types of liver transplant. Basically, you need a liver. So basically, it comes from either a deceased donor, like if there is a patient who has undergone severe brain trauma or stroke, where he has become brain dead. So the family of such a patient can pledge the organs, and you can get the liver from a brain dead patient like that. The second option is that a family member donate his or her part of the liver to save the lives of the near and the dear ones. So now I'm going to talk about the advances in the deceased donor as well as the living donor liver transplantation. So we all know that liver cannot survive outside the body for a very long time, and the only way to preserve a liver outside the body is to preserve them in a cold storage solution called the UW or HTK solution. But then the problem with storing the liver outside the body is that it gives you only a limited time before you can put in the patient. So the average time liver can last outside the human body is around 8 to 12 hours, beyond which even if you transplant the liver is not going to work. So the new way is to put the liver on a machine. Like you can see on the screen that this is a machine called as a machine perfusion, wherein this machine will provide the oxygenated blood and the oxygen, and the liver will work outside the body. The advantage being it gives you more time, and it also allows you to assess the function of the liver outside the body, because once you transplant this liver into a human body, if it is of not a good quality, then patient is not going to survive. So this is one advancement which has come up in the recent past and has changed the field of transplantation in a big way. The second problem of liver transplantation is that there are very limited donor organ available, because the number of patients needing liver transplantation is uh, way more than the available organs to the donors. So because of this, the concept of living donor liver transplantation came into vogue, wherein the family member were asked to donate a part of his or her liver. the it is based on the concept that liver is the organ which has got a huge regeneration potential. Almost 80 to 90% of regeneration occur within 4 to 6 weeks, and within 6 to 8 weeks the entire 100% of the liver grows to a size which is required by the normal body. That's why the donor also does not suffer from liver dysfunction, or the patient also does not suffer from liver dysfunction. So basically, despite the living donor, despite the awareness, there is still a shortage of the organ. So the one way to decrease this shortage is to do a swap liver transplantation. So we all know that for liver transplantation, you need only blood group matching. Like unlike other organs where you need a HLA matching also, in liver you just need blood group to match for a person to donate. But unfortunately, there are instances where you don't have a compatible donor in the family. Like for example, suppose the patient is A blood group and the donor is B blood group. So that's why we cannot take the organ even if there is a available donor in the family. In such cases, we can pair up the two couples, and we can take the compatible organ from the other patient. That is how you increase the availability of the organ. The second way to do is to do something what is called as a ABO incompatible transplant. In such transplant, what we do is basically we take a donor who is not of the same blood group. What we do is we do give them a medication which will take care of the antibodies against that particular blood group. The medicine is called as rituximab, which is given 14 days to 21 days prior to the scheduled transplant. That will wipe off all the cells which produces the antibodies against the blood group, and followed by a plasmapheresis where you remove the entire plasma and replace with the plasma of the donor's blood group. So you can still transplant without having acute severe rejection in those patients. Now, in order to increase the donor pool, other innovations were carried out like domino liver transplant. So in such a transplant, what we do is we take liver from a patient. Like suppose if a patient is suffering from a disease called as a familial amyloid polyneuropathy. So basically, there is a defective gene in the liver, but otherwise the synthetic functions of the liver are perfectly all right. So what we do is we can you can remove this liver and give to a patient who's suffering from advanced cirrhosis, hepatitis B, C, and whose age is over 60 years, because by the time he will develop familial complications of familial amyloid polyneuropathy, that patient will survive. So that is how you can increase the donor pool. So this is another advancement. Now, recently, we all hear that the liver transplant is done robotically. So you can see on the left side a photo of the patient as well as the donor. But however, you can see a large reverse L-shaped scar on the bellies. Majority of our donors are females who are either donating to their husbands, or daughters donating to their fathers, or sisters donating to their brother. And typically, Indian women wear saris, and this scar looks very ugly. So now what we have started doing is we have started doing donor surgeries using robotic platform, which is basically a keyhole surgery. You can see on the right side, you can see there is no big scar on the belly, and the liver is retrieved through a phalangeal incision, which comes under the underwear. So another advancement in liver transplantation is the use of artificial intelligence. Like how sir was mentioning the importance of artificial intelligence. Artificial intelligence has also come up in a big way in liver transplantation, because we are using these AI softwares to review the scan and map out the complex blood vessels, which has made the liver transplantation surgery extremely safe. And we know exactly where we are going to find the blood vessels, and we can avoid entry into those. Not only this, AI also helps in donor recipient matching, where the best suitable donor is matched for the recipient, and we are having successful outcomes. The outcomes of liver transplantation in recent years have improved significantly. The success of transplant is close to 95 to 98%, which was only 70 to 60% before 20 years. Now, if you talk about future, so future is xenotransplantation. Basically, xenotransplantation means transplanting a non-human liver into the a human. Basically, these are bioengineered livers from the pigs, where they are used to take care of the liver function in the body. The other therapy in liver diseases is stem cell therapy, which is found to be very effective, especially in reversing the fibrosis. However, it has not been established in patients who are suffering from end-stage liver disease, but there is currently a lot of work going on in stem cell therapy, and in future we are going to see treatment of advanced liver failure also using this stem cell therapy. The biggest global channel still remains as the waitlist gap increases. The problem is that the technology has evolved, but the gap between the organ supply and the demand continues to grow, because of which thousands of patients lose their lives on the waiting list. And the solution is to increase the community awareness, debunking the old myths that the donor dies, and registering as an organ donor. How we can make the difference is we can have open conversation, not only amongst friends but with families and the close and the near ones. You can register your decisions. You can adopt healthy habits which will prevent the liver diseases, and obviously decrease the demand for liver transplantation and the organs. With this, I would like to end my talk, and I would be very happy to take any questions.
Thank you very much. Please close the slide.
Please do the stop share.
Yeah. Thank you very much, Dr. Hatimi, for giving up the described what you have given today, the latest advancement in the liver transplant. बहुत बढ़िया आपने बताया. मैं सोचता हूँ कि आज हमारे जो members हैं, जो दर्शक हैं, and those who are watching it live or those who are going to watch afterwards, उनको काफी कुछ पता चला कि advancement में liver transplant में कितनी नई चीजें आ गई हैं. Before I will open it for everyone to ask, my first question to you is, how much time with new machine? You said that there is a machine which will keep the liver outside so that the shelf life of the liver increases from 6 to 8 hours. So how much time the liver can survive in that machine?
So the machine can sustain the liver 24 to 36 hours safely. At the max, you can still go up to 72 hours and keep the organ on the machine for 72 hours. Basically, it helps you to assess the quality of the organ and also improves the liver function when it is transplanted in the human body. So it acts both ways.
Okay, so it's a breakthrough and this is only for right now for liver or for other organs also, doctor?
So this can also be used for kidneys also. So it started with kidneys and then it came to liver.
किडनी की कितनी लाइफ हो गई है, शेल्फ लाइफ कितना बढ़ गया है?
So kidney normally can survive outside the body for 24 hours. So you can keep the kidneys outside for 48 to 72 hours with the machine perfection. Should not be a problem.
Thank you very much. Now I am opening the forum. Please ask one question each. Whosoever wants to ask, please unmute and raise your hand. So immediately I will take up the question. मैं जो जिसको भी पूछना है अपना unmute करिए पहले और वीडियो ऑन रखिए और हाथ उठाइए या मैं पूछ लूंगा आपसे. अभी टाइम ले रहे हैं सब पूछने के लिए. मेरा दूसरा क्वेश्चन ये है कि आपने कहा कि मैन आदमी पे ज्यादा लीवर प्रॉब्लम है लेडीज के मुकाबले, विमेन के मुकाबले. ऐसा कारण क्या अल्कोहल की वजह से पर या कोई और कारण है?
So there are many reasons why it is like that. So one is the genetics, the second is alcohol obviously, and third is the incidence of hepatitis B and hepatitis C is more in men compared to women. The reason being obvious that more men are exposed to Hep B and Hep C viruses compared to women.
Okay. ठीक है. मेरे ख्याल से ये भी चीज सबको पता होनी चाहिए, इसलिए लीवर के लिए मैन को बहुत ज्यादा कॉशियस रहना चाहिए. फैटी लीवर नहीं होना चाहिए, प्रॉब्लम हो सकती है. प्लीज अनम्यूट जिन्हें क्वेश्चन पूछना है. आई थिंक आई शुड स्टार्ट फ्रॉम आवर Rotarian PHF Dr. Rohan S. Monis, who is a Chief Administrative Officer in the Kanchur Medical College, Mangalore. Yes, Doctor.
Good evening, Dr. Hatimi. Thank you for that beautiful session. When we talk about liver transplant, we talk about, the liver regenerates. When we talk about the regeneration of a liver in a person who's donated a liver, is there a timeline and are there problems wherein that liver can also get compromised in case the regeneration doesn't happen?
So very good and a valid question. So basically, liver regenerates within 6 to 8 weeks. So like suppose for an example, there is a person who has met with an accident and 80% of the liver is damaged. You remove that 80% of the liver. You just need a 20% of the functioning liver to survive, because this 20% will grow to almost 80% in 4 to 6 weeks and almost 100% in 6 to 8 weeks if the remaining liver is normal. So when we talk about a liver donor, what we do is we evaluate them thoroughly. We check each and everything pertaining to liver, like liver function test, the amount of fat in the liver. We also check for the volumes of the liver. You need a critical liver mass for a normal individual to survive. So we do something what is called as a volumetry to make sure that the donor does not have a problem. Only when all these parameters are met, you go ahead and do the donation surgery. That's why the donors are safe. They don't land up in liver problems in future.
Marvelous. Thank you.
Okay.
Thank you so much. But even
Thank
when,
you. Yeah, sorry. Go ahead.
even when you say that 20% of the liver, which is present in a person with a road traffic accident, and it regenerates over 6 to 8 weeks, so physiologically, the hepatocytes will function as normal as possible.
So basically, what happens is there are two ways regeneration can occur. So one is the hypertrophy, that is increase in the size of the cell,
Cell.
and secondly is increase in the number of cells. So
Correct.
when it comes to liver, it is mainly hypertrophy.
Okay.
Suppose if you remove the right lobe is not going to come back, but it is the left lobe which will enlarge in size and take up the function of the right lobe.
Amazing.
So that is how it works,
Thank you. Thank you, Dr. Hatimi. Thank you so much.
Thank you very much. Rupa Arora ji, agar aap hain.
I would like to ask a question.
Yeah, please go ahead. Our IPP and Inspire President Rotarian PHF Ritika Gupta ji.
Yeah, thank you very much. And thank you very much, Dr. Hatimi, for your detailed presentation. I wanted to ask you that in a liver donor case, is the donor more susceptible to infection, or is it like any other body, or any other organ donation, or is the donor more susceptible to infection, especially in case of liver transplant? Because I know of a case in an extended family wherein the donor was not able to survive. So I want to understand if the chances of catching an infection are higher in case of liver donation.
So this is a very valid question, and in fact, this is one of the most common misconceptions. So let me clear this out. So first of all, the liver donor is a normal individual. Even if a donor donates a part of his or her liver, the donor does not have to be on any immunosuppression medicine. So obviously, the chances of infection in a donor is not going to be higher than a normal person. Donor does not have to take lifelong medication. Donor does not have to undergo multiple testing. Donor does not have to follow up regularly with the doctor. Once a donor donates and discharge after 7 days of the surgery, there will be only one follow-up, which is 7 days after the discharge. And if that follow-up is also normal, then we do not generally ask the donors to follow up with us, because they can have a normal life. The only precaution that the donor is supposed to take is not to lift heavy weight for 3 months. Apart from that, as far as the normal life is concerned, the donor is going to lead a normal life. The problem is that if you're asking about complications in a donor, yes, there are chances of complications in a donor, but that chances is very less than 0.2 to 0.3%. That means if 1,000 donors undergo surgery, only 2 to 3 donors can have problems, including risk to life. That is the right way to put across. Not every donor will have a problem. The complication in a donor is very rare, to be honest.
Thank you very much, doctor. I will definitely have a reply, because I was, short of a reply earlier when I listened to this case. But this is great information. Thank you very much.
You need to find out specifically what complication is there, because unless there is a complication, the donor should not behave like that, to be honest.
Thank you very much.
Thank you very much. Now I will ask Rupa Arora ji. आप हमारे साथ हैं. Rotarian Rupa Arora ji. She is herself is a liver donor. इन्होंने अपने husband को liver donate किया था. I think 15 years back. Rupa Arora ji बताइए आप जरा. और जो question हो या जो बात पूछना आप पूछिए, please.
हाँ, yes sir. अभी last Sunday 5th of July we celebrated 15th liver transplant anniversary. तो ऐसा कोई प्रॉब्लम नहीं है, बट मैंने सर से एक क्वेश्चन पूछना था कि एज ए डोनर जब मैं अपना फाइब्रो स्कैन करवाती हूँ तो वो मेरा सिर्फ स्टार्टिंग में 1 टाइम ही हुआ, उसके बाद कभी भी मेरा फाइब्रो स्कैन नहीं हो पाया. तो डॉक्टर्स उसके लिए मेरे को कोई और ही स्कैन उसके लिए रेकमेंड करते हैं. तो मेरा क्वेश्चन यही था कि क्या डोनर्स फाइब्रो स्कैन नहीं करवा सकते हैं?
See, fibroscan is basically elastography by the use of ultrasound probes. Now, problem is if you have donated your right lobe, the fibroscan by doing a fibroscan on the left lobe is sometimes challenging. So it is
Okay.
not easy to do it by the way of fibroscan. But आप fibroscan के पीछे मत पड़िए, because there are other better investigations to look for your liver health. There is something what is called as a MR elastography,
हाँ,
which
ये
is
सब वही करवाया था फिर.
so MR elastography is a way better investigation compared to fibroscan, because fibroscan में false negative बहुत ज़्यादा problem है.
Okay.
It's not the best investigation, I would say.
Okay. Thank you, sir.
थैंक यू वेरी मच रूपा अरोड़ा जी. और जो अभी माय इमीडिएट पास्ट प्रेसिडेंट ने भी क्वेश्चन पूछा था, तो आपको कोई ऐसा एक्सपीरियंस हुआ आफ्टर डोनेटिंग लिवर की, कोई प्रॉब्लम आई, या जैसे डॉक्टर हातमी ने बताया कि उसके बाद कोई भी प्रॉब्लम नहीं आती डोनेशन डोनर को?
नहीं सर, मेरे को ऐसा सच कोई प्रॉब्लम नहीं आई. आई एम लिविंग ए मोर देन नॉर्मल लाइफ. उसके बाद मैंने ट्रांसप्लांट गेम्स ऑफ अमेरिका में वर्ल्ड ट्रांसप्लांट गेम्स में भी पार्टिसिपेट किया है. मैंने 3 पोस्ट ग्रेजुएशंस की हैं. और आप सब जानती हैं कि आई हैव आल्सो ब्लेस्ड विद सन आफ्टर 3 years ऑफ ट्रांसप्लांट. तो आई एम लीडिंग अ नॉर्मल लाइफ. देयर इज नो सच कॉम्प्लिकेशन.
Okay, thank you very much. I can see the Rotarian Ramnath Pradeep. Yes, Rotarian
Yes.
Ramnath Pradeep ji, please ask your question.
Thank you, sir. Thank you. Are you able to hear?
Yeah, please.
Yeah. Dr. Sahab, thank you very much for your brilliant presentation. I got 3 questions for clarification. One is about what the doctor fraternity is doing for the purpose of creating the awareness, because I find that there is a serious issue of disease, because it is spreading and there is serious issue of the disease. So one is as the doctor level, community level, what are the things are being done. Secondly, second issue is about everybody has asked about how, because people are aware of that the donation can be done and it can be in parts also. So one donor can give part of his liver and within a period of certain time it can happen. Thirdly, I am talking about what are the precautions to be taken by the normal like me or those who do not have as of today the the system of the failure of liver. So these are 2 questions which I would like to be addressed in case.
So,
Hello, sir.
as far as prevention is concerned, so as I earlier said, we are doing measures to prevent the liver disease from happening. Like for example, hepatitis B vaccination has become a part of national immunization schedule. So if you see earlier, during when we were born, we were not immunized for hepatitis B. But now, if you see all the kids who are born, they are mandatory immunized. They are vaccinated with hepatitis B vaccines. One. Secondly, we are doing lot of camps, lot of awareness programs wherein we are telling people about what exactly they need to consume. And as far as the safe limit of alcohol, so earlier we used to talk about what limit of alcohol is safe for a normal person for the liver. So now let me be very honest, no amount of alcohol is safe. Even if you are consuming alcohol on in a minimum amount, can also lead to liver problems. So this we are telling to each and every person who comes to our OPDs. Thirdly, we are running awareness campaigns to understand what exactly needs to be done for the liver safety. That means, as far as the diet is concerned, we are telling them to have healthy diet. We are we are asking them to cut on carbohydrates. We are telling them to take healthy proteins. We are telling them the importance of exercises. We are trying to treat patients for diabetes, hypertension, obesity, which again is one of the main reasons to develop liver diseases. Apart from this, we are also running awareness programs for the donor for potential donors. Like there are a lot of misconception about donating the organ. So we are running campaigns for organ donation also. And as far as you are concerned, what you need to check is So every year you should have a mandatory blood investigation, which is basic liver function test to be done, and a sonography to see if the liver health is okay or not. Because the only problem, as I also mentioned in my talk, is the liver is a very resilient organ, and it is already too late when you start developing symptoms. So majority of the times the liver disease will not have any symptoms apart from little bit of fatigue and weakness. Apart from that, there are no real signs and symptoms when it comes to liver disease. So it is very important to have mandatory checks, yearly checks, and it is simple by doing routine blood investigations and ultrasound on a yearly basis.
Okay.
Sir,
Thank you
this
very
is,
much.
Dr. Saab, one more question I'm asking.
Yeah.
See, today, this disease is particularly when we are addressing in terms of reaching to the people, other people. The reaching to the rich and who can afford really is we can understand, and they are able to understand this the problem of this. I'm talking about in terms of the poor people who are having a lot of problem. They keep on drinking, they keep on smoking, they keep on many of the things which could be avoided. But are we able to reach afford to come to the hospital and do the testing? Because today everybody cannot come to the Nanavati hospital or Harkishan Das hospital or any other hospital. I'm talking about district hospital.
So basically, money is not the criteria to deny treatment to anyone. So as far as our hospital is concerned, 20 to 25% of our transplants are done on charity basis or through funding through the various trusts. So if you see, there are people who are always helping out, like Tata Trust. It is one of the main company which is funding our transplant. Then there are Burma Trust. There are Chief Minister Fund. So there are various ways to raise money when you have a patient suffering from liver disease. So and plus we run a lot of free camps also to make sure that the patient, irrespective of whether they can afford the treatment or not, are taken care of. It should not be a problem.
No,
Okay.
I'm
Thank you very
talking
much.
about masses.
Yeah.
I'm
Thank you very
talking
much.
about in terms of masses.
Pradeep, thank you very much.
Whether we
We'll
are able
discuss
to reach to
afterwards.
them.
One thing which we have mentioned in the reply of Mr. Dr. Ramnath Pradeep is that, और also कि 20% के बाद पता चल पाता है, जब 20% ही बचता है कि हमारा लिवर डैमेज है. और एक बार आपने भी डॉक्टर मोनिस के आंसर में बताया कि अगर 20% किसी का रह जाता है ना आफ्टर द एक्सीडेंटल डेथ, एक्सीडेंट के बाद, तो उसका रिजेनरेट हो सकता है अगर वी विल रिमूव दैट 80%. तो जब अगर किसी जो नॉर्मल आदमी है उसका अगर 20% रह गया पता चलता है, तो क्या हम उसका 80% को रिमूव करके वो रिजेनरेट होके फिर नॉर्मल लाइफ जी सकता है?
That was just an analogy. Like I'm not saying that I will remove somebody's 80% because 20% is enough. But yes, if the remaining liver is normal, the patient can still survive. Like I just gave an example. So that you can understand how resilient liver is. You know, you can still so lot of liver disease. Even if you have advanced cirrhosis, you can still survive without a problem till you save your 20%. Only if it is beyond 20%, then you can have a problem. You know?
Okay. Thank you very much.
Thank you.
Our
Thank you.
Regal President, Rotarian Hemlata Bhandari ji.
Good evening, doctor. It was a fantastic presentation. I just want to know if the patient has blood clots in the main vein leading to the river, how does the surgical team plan to manage this during the operation? Then one more thing, that how does the team handle portal vein thrombosis also? And I want to also know that what is this transplant center specific survival rate?
So I'll answer the last question first. So the outcomes of transplant depends on center. It is very center specific. The high volume centers in the country have a survival up to the tune of 90 to 95%. That is, I'm talking about 1 year survival. So as far as the portal vein thrombosis is concerned, it is a very challenging situation because it complicates the process of transplantation. Sometimes there are situations where you are not able to establish the flow to the liver. So there are various ways by which we can deal with portal vein thrombosis. The first and the foremost, the first way is to remove that thrombus during the surgery. Number one, if you are able to establish the flow, well and good. If that is not possible, then what you do next step is you try to ligate the shunts, which generally diverts the flow from the liver, so you can establish the flow. If that also does not work, there is something called as a renoportal or a portal transposition, where you can take the blood from the kidney or from the IVC directly and give it to the liver. So these are the ways you deal with portal vein thrombosis when it comes to liver transplantation.
Thank you very much. One news I have read some times back, like dialysis, kidney के लिए हो रहा है. They are developing something similar for liver. Is it correct, doctor?
So it is partially correct. It is not completely correct. So there are systems where you can take care of the liver, but that too is a bridging therapy. That is not the permanent therapy. Basically, these dialysis are done as a bridge to liver transplantation, so that you till you get a suitable organ, you can keep the patient alive. So there are systems called as a Mars, wherein it works like a liver dialysis, and it helps taking care of. See, liver has more than 500 functions in the body. There is no dialysis. There is no machine which can replace the function of a liver. Unlike kidney, where if you have both the kidneys failed, you can keep the patient on dialysis for years together. But there is no dialysis as far as the liver is concerned. So you can keep the patient alive till they get a transplant. That's the only way to put it.
Okay, thank you very much. Yes, I think I can see the legal secretary, Dr. Ruby Agrawal, wants to ask a question. Yes, please.
Thank you, Dr. Hunaid, for your wonderful session. I wanted to know that a person who's doing a normal routine test and has come to know that his OT, SGPT levels are high. So just by the scan, do you come to know what percentage of liver is or is damaged or not, or what are this thing a person needs to take the tests further?
So basically, the OTPT being high means there is a transaminitis. It is called as transaminitis in medical term. So transaminitis can be due to many reasons. So you need to find out the cause for transaminitis. Obviously, the function of the liver can be assessed by doing a simple liver function test and a sonography. But when it comes to transaminitis, it is a stepwise approach by which you keep on doing one test after the other to find out the reason for this transaminitis. The reason for transaminitis can be as trivial as just simple cold and cough, some viral infection. That also can lead to transaminitis. That does not mean that the liver is damaged. But obviously, if you are consuming alcohol, obviously, and that time if you see that the enzymes are high, you need to immediately stop the alcohol, because that means that the liver is getting damaged. Or if you are consuming some medication which is affecting the liver, you need to stop it. Majority of the cases, it is Ayurvedic preparations which are high on heavy metals, or you are taking some kada, or you are taking some giloy. So all these things needs to be cut down, and obviously there are tests to find out the specific reasons for liver damage. You can always do it and find out the reason for it, and you can stop it.
Okay, thank you very much. I think we have asked lots of questions to you. Two things which I can judge from your talks. First thing is the advancements are going on, and that now the shelf life of the liver can be enhanced. Number one. Number two, according to you, if we have to keep our liver healthy, we should not try any non-prescribed therapies like kadha, or like people are even taking the turmeric, हल्दी पानी रोज पीते हैं. ये सब चीजें नहीं पीनी चाहिए, which affects the liver. आयुर्वेदिक और बाकी जो unconventional medical therapies हैं वो हमें नहीं लेनी चाहिए.
Sir,
Alternative.
Ayurvedic, sir, I just want to clarify here.
Yeah.
See, the problem is we have no problem with Ayurvedic preparation. But what is the real problem is when the Ayurvedic medications are prepared on commercial basis, it's a problem, because they are not supposed to be made in commercial basis. The moment you do it, it contains a lot of heavy metals, which again is hepatotoxic. So true Ayurvedic medication is not a problem. only which is available in the market currently is a big problem because it is very high on on heavy metals.
You mean to say जो वैद्य बना के देते हैं आयुर्वेदाचार्य होते हैं जो असली होते हैं और जो
Yeah,
अपने आप बना के हाथ से एक पर्टिकुलर पेशेंट को देते हैं वो सही है
वो
मुकाबले
safe है,
में वो सेफ है.
But what is available in the market is absolutely unsafe. Absolutely unsafe.
Okay.
Sir,
Okay, thank
can
you.
I ask one
Yeah.
question?
Okay, yes, very short question.
I
please.
want to ask one question.
Yeah.
Yeah. Because I in the the Ayurveda side, doctor has not prescribed. I consulted the Ayurveda doctor, but I have my own because of some friend circle who has been benefited by this. So when I take, I am diabetic also because the diabetic patient more are prone to go this type of thing. So I take 3 medicine. I don't buy from the Ayurveda, the Ayurveda shops. I prepare at home,
That is
like
safe.
turmeric, like jamun, like amla. There are 3, 4, the contents which comes to me, and I take every day at 6 o'clock in the morning. Do you feel that this will also damage? It will also create a problem?
No, I don't think so. No, I don't think so.
Okay.
So I
Yes.
can continue safely, can take it.
Yes, you can.
Thank you,
Okay.
doctor.
Thank you very much,
Because
doctor, for giving so many replies. And I'm sure कि आज का जो प्रोग्राम हुआ है काफी लोगों ने देखा है और जो देख रहे हैं या देखेंगे बाद में भी या जो मेंबर्स ने आज अटेंड किया है in spite of the Wimbledon final also, it's a very big thing. तो आप लोगों ने देखा और जो डॉक्टर साहब ने बताया है इतना डिटेल में डिस्क्राइब किया है, it will definitely benefit. Over to you, Regal Secretary.
Thank you so much, Founder and Charter President Rotarian Lal Goyal ji. And आपका बहुत बहुत धन्यवाद डॉक्टर हुनैद जी जो आपने इतना पेशेंटली हमारे सारे रोटेरियंस का क्वेश्चंस आंसर किए.
My pleasure, ma'am. Thank you so much for inviting me, to be honest.
Best now our Rotarian PHF Dr. Rohan Esmonis जो मैंगलोर से हैं to give the vote of thanks.
Good evening, everybody, and namaste. At the outset, I would like to thank from the bottom of our hearts for Dr. Hunaid Hatimi's time. Thank you, Hatimi ji. It was a beautiful presentation, very descript, very simple, because we have a lot of non-doctors also on the panel over here. And as we speak, this is also being live streamed on YouTube. The beautiful, progressive, even the images that you've showed, I mean, from a fatty liver, going to fibrosis, going to cirrhosis, to cancer, and the ways of prevention, and how exercise and eating healthy food and eating a low carb diet actually helps. And because I think the ground which we need to practice right now is prevention. Dr. Hatimi ji, we wish you all the best in all your endeavors, in all your successful practices. And I know because a transplant job is not an easy job, and you've taken your time out from your busy schedule. Thank you so much. And I also thank all the Rotarians who have taken their time out in spite of having the Wimbledon finals today. And have a beautiful week ahead. Thank you, everybody. Good night.
Thank you so much. Thank you so much, all of you. Thank you so much. It was a pleasure spending time with you all. Thank you.
Take care.
Thank you, Dr. Munis, for the vote of thanks. And I request the President to adjourn the meeting.
Thank you very much for attending the meeting. Thereby meeting is adjourned.